everybody can hear it. Here's the question. What do you think, what works for pain? You seem to be positive about medicines, alternative therapies, meditation, yoga, and even medical procedures. Where do you stand? Complementary medicine or mainstream medicine? Is that right? Did I get that? Okay. It's a pretty big question, but the question really is, the way I look at it is, what do you think works? Well, I hope you aren't offended by my answer, but I stand with what works for people. This is what I believe in. What works is what I believe in. What works is best. I believe we have lots of medicines and procedures and alternative therapies and complementary therapies that improve pain and disability. I also believe that we may have teachings and that can heal and shift focus and change perception and help pain and suffering. Suffering, I differ from pain in that it includes the loss of your identity, your loss of job, the way you experience the pain, the relationships you've lost, the disability you have, the change in your normal path. We can help people find new opportunities and new ways. That is why we created this seminar, for example, Find the Best Program for Your Pain, and you can discover new opportunities. Now, the discussion group, Triumph Over Persistent Pain, also explores other opportunities, but the key here is all these opportunities help you better manage your pain and your suffering, and there's lots of them. They're dynamic. They're across the board. I was a doctor and couldn't control my pain. I went to other doctors, and they made my disability and pain worse with medicines. I found acupuncture, physical therapy, exercise, massage, herbal therapy. And I ended up only needing herbal therapy and exercise at this point in time, with an occasional massage after one of those bad traveling experiences. But, mainstream medicine I looked to, and it failed me. So I looked outside, and I looked for what works. I looked for what works for me, what minimized my disability and helped me move forward and be active and not experience suffering, because I needed to move forward with my path, and the medicines were making my medical problems worse and making me worse, so I chose a different path in the opportunities for pain management, and those helped me overcome the suffering, the disability, the change in my life. So whatever modalities work for you is good. For me, modalities like surgery and pills did not work. We all need to explore all the opportunities. Now, those modalities like surgery and pills may work for some people. It's usually a mixed bag. It's usually multiple things. You may find mindfulness and meditation changes your perspective. Massage relieves your pain. Aromatherapy relaxes you and helps relieve your pain quite a bit. Yoga improves your strength, limberness, and changes your focus off your pain. You need to find what works for you. Do it. What works is best. Okay? And it usually starts with finding someone that will listen to you, and someone that will communicate with you, and someone that will help you educate you on all the opportunities. Do what works. I am for what works. And hopefully, in the rest of this seminar series, we're going to explore all these opportunities, and you'll find out something that works for you in both pain and suffering, and be able to move down a better path and have better days. Alright, so that's my answer. What works is what works. Now let's try to go find that together, what works for you in this seminar. That